So a scientist has made the alarming warning that Gauteng will look like India. Professor Francois Venter, a communicable diseases expert at Wits University, says doctors have already raised alarm about the increased cases in Gauteng, which has seen the highest number of infections this week during the daily COVID-19 confirmed cases announced by the health department. This has been the case for several weeks now. It's reported that oxygen usage has also increased as hospital beds run out. Professor Mellado is a member of Gauteng's Premier Advisory Committee. He joins us now. Very good evening to you, and thank you so much for speaking to us, Professor Mellado. We have spoken about we've been speaking about how serious the case is for Gauteng, but what does the modelling tell us for Gauteng? What have been the discussions within the committee of how serious the outlook is?
Right. So already last week, when we had the press conference with the Premier, it was becoming evident that a second spike in the number of cases was occurring already as early as Wednesday last week. And the number of cases and active cases was becoming higher than the predicted in the worst case scenario. That already points to the fact that something serious was happening that was not accounted for. And then on Saturday, we were informed that there is a good chance, there is a good possibility that that there is a variant that's becoming dominant in the province that is more infectious. So that seems to explain a lot of the stuff that's happening with the data, especially the second spike we've had of cases in the province. So what we're doing right now, as the information was coming in on Saturday, we activated a contingency plan in terms of modeling, where we were thinking already, we're prepared already to incorporate the emergence of a possible strain or a different strain into the modeling. So by Sunday and Monday morning now, we were able to get the first modeling out of the modeling team. So with the data of the next few days, we'll be able to ascertain how serious the situation is and how far down the road will the peak be pushed.
And just tell us, the next 14 days, are they enough to bring about a significant impact in the reduction of new cases?
The reinstating level 4 has been very, very important. There's a number of targeted measures that will help curb the number of infections. Typically, what we've seen in the past is that when a new level is put in place, we see the effects of it between 1 to 2 weeks. So certainly a 2-week period is enough to ascertain whether there is a significant impact on the number of cases and other indexes.
So there has been a prediction by some that over the next couple of weeks we're going to see a plateau. Is that reflected in the modelling for Gauteng? We're speaking to Professor Salim Abdul Karim earlier on. He was saying while they're not accurate, but they're very important planning tools, modellings.
Right. So as I said earlier, it is too early to predict exactly what's going to happen in the next couple of weeks, because we are in a new situation that we have to understand, and there's frantic efforts from different quarters and different stakeholders to understand the numbers. So the numbers that we will get today and Wednesday, Thursday will be absolutely essential to understand whether we have acceleration in numbers, we have increase in the rates, and where we're going with this. And with this data, we will be able to measure a very important parameter, which is the rate of reinfections that the data will tell us. So based on this data, we'll be able to be certainly much more accurate than we can be today. So in reality, when it comes to this kind of situations, 3, 4, 5 days is actually an eternity, believe it or not.
I mean, if we look at the fact that there has been, traveling in and out of the province has been prohibited, but is the fact that Gauteng, being the most populous province in the country, a harbinger for what is likely to come. I'm thinking, as much as we would be taking on pharmaceutical interventions, people are not complying with these regulations. Is it going to be even more difficult for us to fight it? The fact that there will be some sort of internal travel, because there are some people who still have to report to work.
You're asking a very good question. The issue of adherence to social distancing and compliance has been a significant issue and question that we had to deal with since the beginning of the third wave. We have seen from reports and also from the way the pandemic has evolved that the level of adherence during the third week in general to social distancing measures and rules and regulations has certainly degraded. That being said, we believe the situation is serious enough, and a lot of effort has been made through the media and through other stakeholders to raise awareness that the situation is very, very serious and that the healthcare system is under severe pressure.
We were speaking about the South African National Blood Service findings earlier on about seroprevalence, the fact that the black populations accounts for a significant number of those who have antibodies because they have contracted COVID-19 along the ways. And a big part of that research, according to the study, is because this is the demographic that doesn't have access to clean running water, for instance, or access to some of those non-pharmaceutical interventions, the money to buy a mask, they can't social distance, for instance. Will extra effort be made to help this demographic?
So the issue of social vulnerabilities in the context of COVID-19 has been discussed already for a long time in the province. We have come up with indexes of vulnerability for the province that takes into account factors that contribute to people that are, for instance, living in congregate settings or living in informal settlements or don't have the access to sanitation that other people do. And that's taken into account in an overarching index of vulnerabilities that we have put together and that can even be visualized by everybody else. So all this information has been passed on to the policymakers in order to really visualize what are the areas that need most help, what are the areas that are more susceptible to these problems because of social vulnerability. So we certainly have made over the past 6 months an effort to raise awareness about that and quantify it from the modeling standpoint by creating an index that helps us understand where the vulnerabilities are more severe in the province.
So, Professor Mellado, some sectors are saying, is effort enough being made? If you talk to the ECD sector, for instance, they're feeling very bitter that they have not been extended into the invitation of those who will be vaccinated. If you look at the teaching sector, which they fall under but not quite. The taxi drivers who also consider themselves frontline workers because they ferry people back and forth, even during a lockdown. Is consideration being made that they be brought forward for early vaccination as well?
You're completely correct, and that was the point of my earlier comment and my earlier answer. So, in anticipation of the fact that there are serious social vulnerabilities in the province, we've generated this index that helps policymakers navigate through these complexities and the issue of social inequality that many times, more often than not, drive the probability of someone to contract the virus. So these indexes, our job as a committee and as an advisory committee is to provide as much information based on analytics and data that we've collated from many sources to policymakers to act accordingly. So in the context of vaccination phase 2 and phase 3, we've developed this index so that we are able to monitor and help policymakers monitor that the rolling out of the vaccine is equitable and that people with more vulnerabilities are not left behind. And that's the reason why we have created these maps, these very detailed maps of where the vulnerabilities are located.
All right. Hopefully you'll have time to share them with us in more detail at some point. Thank you so much for taking the time to speak to us, Professor Bruce Mellado is a member of the Gauteng Premier Advisory Committee on COVID-19.